I think the biggest thing is, I really felt like my handcuffs were on me when I was working in the healthcare system, and so my biggest goal was to try to free ourselves from some of the burdens that not our profession has made, but just some things that just have grown throughout our societal growth. The only way I could figure out to kind of get the cuffs off were, every patient comes to us at a different point of readiness to change, and the only way we could get there is when it was a one-to-one conversation.
Hi, I'm James Spencer, the Vice President of the Academy of Orthopedic Physical Therapy. This is our podcast, Orthostatic. I'm here today interviewing Matt Haberl and Jake Dorhorst, who are in La Crosse, Wisconsin, working in private practice. We set out to talk about self-pay physical therapy, but ended up talking a lot about the relationship that a provider has with their patient and how that's not only so important to care, but also very important to running a clinic and continuing to work with your patients over the lifespan. I hope you enjoy this episode. I'm here with Matt and Jake out of La Crosse, Wisconsin. Why don't you guys tell me about your practice?
So we work at a small private practice called Dynamic Performance and Therapy. We started out as a predominantly self-pay clinic. Really, there was just three of us that it kind of started out where we really started out as a self-pay clinic because we each were kind of starting our own really kind of private practice where we were kind of thinking we'd be each doing our own solo practices, but wanted to share, some of the common marketing and just, our mindset was to really change kind of what physical therapy was to the consumer in our area. A lot of times pain and torture is always the common acronym, and over time, as each of our individual practices kind of got busier, we started to see that there was more that could be provided, really. And so our practice has now grown to, we got 9 clinicians, 12 staff. We're still 75% self-pay. We do have some insurance contracts now on the side that we still see about 25%. So it was myself and 2 other clinicians that started, and then over the time, picked up Jake along the way. He came in as a student, did our residency program, and he was also, I'll let him talk a little bit about his background, but he was also a CrossFit coach prior to this. We were in the same facility when he was doing some of that, and so if you want to.
Sure. Yeah, my background was I was first like volunteer with Matt actually in my undergrad and was pre-PT, but then after undergrad, before PT school, worked as a CrossFit gym as a full-time coach for ended up being about 3 years, I think it was. And then during that time, the facility had opened up in the same building that Dynamic was opening their location. So I'd already known Matt, so I already knew like, okay, there's some things we'd like to try to do to partner and work together. So I kept pretty close contact with Matt. We did a lot of things in our CrossFit gym, trying to integrate just screenings and being proactive with injuries with people in the gym. As I kept going, my goal initially always was PT school. So down the road, I kind of got that itch again and reapplied and then went to UW La Crosse, and ended up kind of coming full circle. Got my last clinical rotation at Dynamic, so was there, and then got hired, and then continued the residency with Matt, and then here we are. So kind of came all back around full circle, and Matt's kind of been a big part of that piece for me is kind of along the way. So it's been great experience to work with him and continue to work with him here as we keep going forward.
That's great.
And when we kind of got started, we wanted to develop that my PT mindset, and I think that's where it fit well for Jake to come and join our practice in the aspect, like, he already had some some people in the community, some former clients of his that already had kind of earned his kind of respect, and really trusted in Jake. And so with our model, that was kind of the idea, is develop that my physical therapist mindset, and then also kind of changed a little bit of how the traditional model of employment works in our area, where we have more of, I would say, kind of like either a legal firm or a dental office. Like, our model of payment is also different, and so it's built a little bit different than like your employee based models, either in corporate healthcare or even some of the larger private practices, which we feel has kind of really helped kind of that 3 individual clinicians to grow to where we are today. So
Neat. I wanna dig down into that a little bit, and I do want to get to talk about the self pay model and how you got there for your patients, self pay, out of network, cash PT, whatever you want to call it. I want to get there, but you're starting to answer a question that I wanted to ask as you were talking about your business there. So I'm not familiar with the my PT model. I think that I get the gist of what you're talking about, but how is it really set up? Tell me about that.
So, first kind of going back to like, I think it was Vision 2020 where we wanted, the my physical therapist mentality of, when someone's hurt or they have a physical therapist they go to, just like we each have a dentist, right? And so, I think it's kind of creating that same mindset of, we become their primary, musculoskeletal therapy, I like to even say neuromusculoskeletal physical therapist, right? So anywhere from the nervous system to the musculoskeletal system. And so a lot of our, I would say, our model is built off a lot of kind of word of mouth referrals, and then based off of the branding, those who don't, aren't referred to a specific therapist, then will go to any therapist with the mindset of, that therapist hopefully becoming their physical therapist to go to in the future. We do pride ourselves on early access, so we try to pride ourselves on seeing patients within 48 hours if of a requested appointment. Because we all know that the sooner we get them in, the better in terms of all long-term healthcare outcomes, right? So I think by creating that relationship up front, really, really creates then a long-term relationship. And we even try to have our therapists even reach out to former patients, just to make sure that, they continue on. And we even look at things across the lifespan. I think historically, we've been within the medical model where we treat medical conditions. And then once the medical condition is treated, care ends. Where, Jake can kind of talk to this in terms of, especially when we look at like the CrossFit population, people who are highly active, but, sustain injuries and stuff along the way, we can help them from injury prevention even before that, right? And then all the way through injury and back. And when you get into more of that performance side of things, there is no real end to a patient's care, just like there's no end to your dental care. There's things we do on a day-to-day basis to, keep our teeth clean, keep our clean teeth healthy. Doesn't mean we don't doesn't keep us from getting cavities, but we do these, behaviors that really kind of integrate how we can kind of create that, self-help, but then also have that provider there to kind of guide their care. So
How long have you had this practice?
uh, coming up on 9 years here.
9 years. So I've had my own practice for three or 4 years, and a lot of the things that you're saying that you've implemented in the way your business works, I think is a lot of the things that 3 or 4 years in that I'm casually observing in my business that patients clients are beholden to their physical they're with their physical therapist because they like their physical therapist and they have a relationship with that person, and that's a really important part of their care to them. Even if you can provide a substitute PT to fill in sometime, they often don't want to go with that person. They'll oh, James is out of town, I'll wait for James to get back, or so forth. So I think that's really interesting that you have that you've drilled down into that and have implemented as a part of your practice. And what you're saying about care going on beyond what we would normally think as a discharge or an end of care, and that there's a lot of people out there who want their care to go on in a different form. Can you talk more about that? And maybe this is where I put Jake on the spot.
Yeah.
Sure, you can put me on the spot because I have just a fun story to add to it too. Because something that I'd done after my undergrad is I did a study abroad internship in Australia in Sydney for 3 months, and it was in a sports medicine clinic where in there a lot of their system is privatized. Like a lot, they have their government based system that you can go to where you have a long wait time, and then a lot of it is private. So I was in a private outpatient physician clinic, and then in that clinic, the physician employed a physical therapist, he employed a trainer. And a big thing of their model is they have a lot of private physical therapy clinics there. So as I was working with this physician, people would come in and he would ask them, "Who is your physio?" Like that would be the question that he would be asking every patient would almost have an answer. They would associate with someone who is their physio there as their go-to person. So the funny thing is after coming back was when Matt was opening Dynamic. When we sat down and had coffee when I got back, and when I was starting the CrossFit gym, and Matt's talking the same thing, and I'm like, yeah, this is exactly what we did there for 3 months. Is we're communicating with the physio. If they didn't have one, they went to our physio in house, and that became their person. So um, the same thing, that kind of flow system between a primary care versus a physio versus then the trainer, like that gym had it. It's our building that we were starting to have was trying to kind of have that same thought process and model of that each person is a part of that team. For each clinician trainer is a part of that person's care team. And where you are in that model, I'm the person seeing them as a trainer at that time on the day-to-day basis. But if you have something come up from something that's a pain, an ache, something that's not like, I'm for example, I had people who their shoulder would continue to be limit them with overhead movements for months and couldn't do things, and it was a limit to my knowledge. Well, then I would point that out to him, send him over to Matt, and you kind of have that back and forth. Matt can come talk to me, and those relationships just continue to grow as we do that. And now today, the connections Matt has, I have made with the gym I used to work at, other gyms in town, allows us to then, yeah, continue to blend that. I just yesterday was sending text messages with a trainer in town about a client, and then just yesterday we were talking about the My PT. I had a high school athlete who drives pretty far away to come see us. Who someone had told her, "Why don't you go see this PT here that we work with?" She's like, "No, I have a PT, Jake. I like him a lot. I'm gonna go see him instead for for this injury." And she did. So she made the time to come see me instead. So that connection of like having a person relationship, but then exactly that, like building those relationships with other professionals, in trainers, in chiropractors too. And in kind of our like United States system, a large chiropractic network of people that can then connect with them and have a team approach too, I think really helps to elevate the self-pay model and put a firm stakehold of what physical therapists can provide.
Nice. And so it sounds like you guys are referring to a lot of outside providers outside of your business. And are
Yeah,
is that
Yeah.
comfortable or is that uncomfortable? Worried that they'll ever, that they'll ever come back, or how do you feel about that?
I think at the end of the day, it really depends on the relationship you build with those patients, right? And then we can be our worst enemies at times, right? In terms of if we're not comfortable with something, we're more fearful of referring them out of network, well, or out of your clinic, and they may not come back. Well, or is it like you're trusting someone, right? You're entrusting that this person's going to get better care with the addition of another provider, right? And so then that patient sees that, right? They trust that their care is at the center of your treatment, not just based off of your whatever it may be in terms of trying to keep them in clinic, right? So so at the end of the day, it actually becomes a stronghold because the patient recognizes their care is now at the center. We're doing whatever is best for them, and they see you as a part of that recovery process or wherever it is they are on their journey, right? So I do think sometimes we need to tear down the walls. We do it all the time in the hospital systems, right? We kind
Yeah.
of, yes, we have our different specialties, but on the other end, and this is kind of what I always say to our in clinic is we are stronger together than we are in silos, right? So we can get more done, we can create more change when we work together versus when we work in isolation.
I think you're absolutely right. But I also want to acknowledge that I think new business owners, it's a bit of a journey, and finding that confidence that, I've done the right thing, I've provided the right care, and yes, the next patient is going to call, and that
Yeah.
person will, may return on their next issue in a few years. Um, let's shift gears a little bit, and let's talk about let's talk about self pay a little bit, and what in your practice made you want to offer that to people and pursue that with people.
I think the biggest thing full disclosure, when I walked out of PT school, I was anti private practice. I thought private practices were money making joints, like that's all they were. And again, self-reflecting on it now, I think some of it probably was from the biases that we were taught through school. And, we were only taught one method of payment, and that was through Medicare, and so, but then after going out and working, really, I worked at a rural health, kind of rural kind of small hospital system, then went into a larger, kind of bigger hospital system, and started to recognize that, at the end of the day, they're just corporations, and small businesses and corporations both have their places, right? What happened for me personally is I felt like I was having to start providing care based off of either a payer-centric model, or even more of like what's the word, a provider-centric, right? So I either had to do the model of care that was in these systems versus providing more of a patient-centered care. And so that's where we started to kind of transition. And then also just recognizing, no matter where you are in healthcare, finances are involved, no matter what, right? But value, we've always talked about value. And I think many of us will go to our bias of, well, how much does it cost? That's what value means, right? Value-based care, even within the insurance system, is how much does it cost, right? But from you as a patient or a consumer, right? I always give the analogy of, if you had a leak in your basement, right? um, at what point is it going to be where, hey, I can fix this weekend, I can wait off till the weekend, or I have a major leak, it needs to be fixed now, right? Value is based off of what your needs are at that time. It's going to cost you a lot more now, to have that plumber come in versus being able to wait till the weekend, right? And so that all changes, and this is what woke my eyes up. Is the same happened to me with our dog in a vet appointment on the weekend, right? I had to pay that additional fee with seeing someone out of normal hours on that weekend, but you know what? There was a lot that mattered at that time. And so value is not just a price tag. Value is it convenience? Is it expertise? Is it, whatever it may be? And so, like, helping and most patients, that's what they see, right? They know that there's a cost, and it's our job to figure out, is the cost the main priority to them, or is it something else? And then we don't hide from the fact that, what, your healthcare costs something. And so even when we have a new patient call, we have a script that we provide, and it starts out with, what are you being seen for? Is there a therapist you'd like to see? Have you seen PT in the past? Because what's their previous experience with PT, right? Is it positive or negative? And then, how would you like to pay for today's appointment, right? So it kind of encapsulates, just like you would if you were to have work done on your house, if you had to go to the vet. I think those are the things, is when you put the patient, they are the one who have control of that decision, rather than sometimes we get into our payer centric, the third party payer only provided does 10 visits. Those models really restrict what you can offer for the patient, and providing that really, patient centered care, and creating that kind of patient centered alliance.
Right. It kind of shifts away from this idea that like you mentioned, we've been educated in, and that we think in, and that we're just like fully indoctrinated in, of what does the patient need? What's justifiable to their insurance, to switching to, what does the patient want? What does this
Yeah.
person want for their body and their care, and their health? But I see an obstacle that I want to ask you about, and how you get around it, which is, I think people are ingrained in that as well. That public is, where if I'm getting health care, it better be covered by my insurance. Do you have any
So,
comments
yeah,
on that? Yeah.
and I would say that in my opinion, like, from our patient population, again, I think it starts out with that question I said before: how would you like to pay for your appointment? And so then it gives them the opportunity to, because if you think about how many of our patients go and pay for massage therapists, right? They pay for a personal trainer, any of those other things. They'll pay for a lot of other things because that's the option, right? If they want to use their insurance, the first answer will be, well, do you accept insurance, right? Or do you accept my insurance? And we can look into that and see what that would be covered, and then we can provide them a basis of what that is. What we've seen, especially in the third party world, is there's in our area at least, a definite increase in high deductible plans, right? And so with the high deductible plans, patients are paying that 100% until their high deductible is met. And so in our area, I'd say, unless they're having significant care, significant treatment in somewhere in the medical system, most aren't meeting their deductibles. And then when we provide them the cost to go through insurance or your third party payer versus a self pay option, we can see them 3 appointments to 1 appointment, right? So you can kind of see that when you start to look at the value aspect of things, it's pretty easy for them to see the difference and what's more valuable. Now,
Yeah.
there are
So
patients that,
let me jump in
yep.
because this is new to me. So even people whose insurances you're in network with and accept, or that you accept their insurance, you're giving them two options. You're saying, here's what it would cost through your insurance for so and so visits, and here's what it would cost paying out of pocket.
Yeah, except we do have two different systems that we're working within. So it's not one system. So we have kind of two different systems we're working it within that allows us to do that.
That's great. I just wanted to lean into that for a moment.
Yep.
Sorry, go on if I haven't derailed you too far.
No, and so I mean, I think at the end of the day, I think sometimes it comes back to, because this is the other question we always get. Well, you're only providing care to those who can afford it. Actually, not. We see a fair number of individuals who are farmers, and you know what they like? Transparency. They know what it's going to cost. They know
Mhm.
exactly what they're paying for when they're paying for it, right? When you look at the third party insurance world, there's usually that delay in payment, right? I mean, so if I come in, I got acute low back pain, I need treatment today because I hurt today, right? We do treatment, they pay for it up front, we go on. The third party side of things, you treat them, 3 months go by, bill comes to the patient, they're no longer in pain. Guess what's not as was it wasn't as needed at that time as it was 3 months ago, right? And so there's just that whole dynamic that we're constantly battling in the third party world that makes it a lot more challenging, right? And from a
Yeah.
patient, consumer standpoint, I mean, this is where I feel like our profession can learn a lot from consumer research and understanding, the value of things, not just the price tag of things.
Mm-hmm. Mm-hmm. There, I feel like there's a lot of different directions to go from there. But I kind of want to go towards that feeling again. I think of our profession, right or wrong, that we're healthcare providers. We're here to serve people, to be servants of society. And you talked a little bit about how some people without all the finances in the world are still able to see that value in choosing to pay out of pocket for physical therapy. But I think a lot of people who may be considering introducing cash to their practice or going into a fully cash practice are grappling with that. What's my role in serving my community, and what's my role in making sure that I have a sustainable business model.
Yeah, I mean, I think it's a great question. I mean, I think we all have different ways we can provide service too, right? And so I think those are different ways that, like, so we still do community projects, we still do charitable things. And so I think that's the reality of, like, it doesn't necessarily mean it always has to be providing free care, right? And then how is that then equitable to those who can pay, right? So there's that whole balance that I don't think we'll ever have a true answer for. I think it's kind of looking at, right, because at the end of the day, what we do, we can't always just give away services, right? And so there's also a value to our profession. And so how valuable is our profession as a whole? And I would argue we've been undervalued as a profession for way too long, right? We
Yes.
have a significant amount of educational debt without a lot of return on investment. And so I think we have to come back to, like, again, there's two sides to every story.
Yeah. I mean, I want, I'm here to ask you about your practice, but I'll just simply say with my practice, the insurance reimbursement I could get around here for driving to my patient's home, seeing them in their home, and then leaving is not worth my going there. So,
Agree.
so
And
we have to find other models.
yes, and I think that's the biggest thing is, like, why are we the ones always bending and breaking our backs when we know there's other third party payers that are doing just fine?
Yeah. Yeah.
And I would add something too. I'm
Please.
just going to interject a little bit with
Yeah.
because I'd worked when I first started Dynamic being self-paid. Like, we had to build a client load, so I worked at a rural system in town too, and dealt with the primary insurance base. And what do you get when someone is they're investing with a self-pay? They're putting the money forward. They're automatically invested. Versus what does our insurance system almost do? Even though they don't know they're paying up front, they might end up paying, but they're looking at it as you're going to fix something for them versus they have now an investment. They have put this money down that they are going to be committed. If I give them an exercise program, I I think anyone that's worked in a self-pay clinic would agree their compliance is astronomically better than somebody in the insurance-based model of how well they're going to commit to doing their interventions, their exercises at home, and how committed they are. I mean, when you anytime uh, you're putting something forward of your own, you're going to get better results from it, right? As a person, if I want to learn something, if I go pay for that education, I'm going to value the education a lot more versus if I get free education off the internet is not the valuable that I did if I went and paid $1,000 for a weekend course. And then the second thing from just a I know clinician perspective too of that, if you're in that insurance model and just kind of the kind of kickbacks you get from those sort of things, it kind of deters your, I mean, even I was there, like you lose your motivation to try to like pour yourself and being that servant to the patient in a way because you kind of just get kicked your dirt in the face. They come back, oh, I don't feel any better. I feel worse. Did you do your exercises? No. And you have that same conversation multiple times a day, week after week. You lose that kind of fire that, I mean, as a new grad, I mean, I know I came out with that and you're kind of just getting that thrown back in your face. So by then working with motivated patients, you get that like kind of return on your time and investment too, where I'm pouring myself into a session. I'm trying to do everything in that 45 minutes or 60 minutes with the patient that I can, sometimes more than I should be doing too, going above and beyond. But then it's returned back to you, and that how they respond, how their results are, and then they continue to come back to you, right? Like then it's your down the road. They're coming to you the next 6 months later, the next year for their next injury. They're referring three other people because of how their difference in care that they receive from you compared to when they went to the larger medical system and the person sat on their computer most of the time and led you through a stretching routine or an exercise routine versus me sitting next to you and being face to face and investing myself. Like you get then your efforts have reward, which is such a powerful thing, especially as a young clinician, to then continue to push you to grow and be better and enjoy the profession too.
Yeah, I think that that intrinsic feeling of goodness is essential. I mean, to just
Yeah,
to life. Never mind
yeah,
physical therapy and all of that. I think it's a reason a lot of us are in physical therapy is to do some good somewhere. So I think you make some really great points on how that's returned to you with these patient populations. You guys talked a little bit about reaching back out to the people and kind of that continuity of a relationship. What kind of stuff are you doing to remind people that you exist and that maybe you have something to offer them? What do you guys do?
So the way we have it set up is, for every patient, we have essentially a return visit reminder that we can send out a month or two. I the way I end it with every one of my patients is it's more of that graduated kind of progression. I may start out once a week to once every other to once every 6 weeks to then, when they're ready. And at the end of every session, I ask my patient, what would you like to do for follow up? So I always leave it in their court to make that decision. If they value my opinion, they'll say, well, what do you think we should do? Right. Or if they have a busy lifestyle and they say, well, I'm going to be traveling for the next 2 weeks, I'll follow up with you in 3 or 4 weeks. And so it's always that constant discussion. Every appointment we're having that kind of what is it? The decision. What's the word I'm looking for? The collaborative decision making, right? So we're always having that collaborative decision. And then for those patients who is like, hey, you know what, I'm good. And then I'll say, you know what, let's do this. We won't schedule anything, and I'll follow up with you in 4 to 6 weeks. And then I can set in my scheduling system. I can send out a reminder either email. A lot of them, because we've kind of developed that my physical therapist mentality, like they'll even be like, I know how to get a hold of you, and they'll self schedule, they'll call into our clinic, and it's not uncommon, for, I see a patient once for their knee, and then all of a sudden now they're back later for their back or their neck, right? And so it's just like if, my tooth hurts, I'm going to call my dentist up, right? Even though there's probably 30 dentists in our area, I still go to the one I know first, right? And so it's the same idea. We become that primary care provider for that patient rather than, and I would say all of us, like my back hurt 2 weeks ago. All of us at some point probably have some ailment, right? That hits us, and I always will work with the patient of like trying to teach them how to self treat it, and if they can't self treat it, You have the tools aren't working for you. That's when you come back, and then we can sometimes do a tune up or whatever it is that you need. So I'd say that's probably as a generalistic response. That's kind of how we've done it over time. And each therapist has a little bit different option with it. But if you got anything else.
Yeah, I guess in some of the little different way I may take this too, James, is just with when you're referring to like those connections outside the clinic too. I think that's exactly what Matt said. I think each person, like I had those coming in from a trainer perspective of clients, but then also other trainers in town, and then I had some chiropractors as well too that I had seen myself or had come in contact with at that time. Um, the a comment I want to jump back to what you said before, like handing someone off sometimes too, like having that person you can send them to or communicate with who's their continued like person of care, right? Whether that be a trainer, a lot of people, it is a chiropractor, especially in our area. A lot of people will see their chiropractor every month at minimum for the rest of their life, right? Like I can hand that off to them still to some extent of what we've done. But where I was going there was that what you're doing then is by like Matt's saying to kind of combine everything together by teaching them the tools, having that person that you're kind of handing back. Often, if you're giving them the proper education and doing things right, like that it comes back full circle. Like I would put probably like the thing on the therapist is like if you're investing yourself in if you're investing in them in the session, teaching them the tools and like showing them how to take care of it, they know your value. They know where you stand and they will trust to come back to you. It's just a big part of that trust side of things and then how well you're developing that relationship and education.
Yeah. And along those same things, this is where we do our other community things. Like we go to some of our partners, like the other gyms, and like we'll do education, and so I think also being involved in the community is just as important because, like I said, we all have an ailment that pops up somewhere along the line, and I'm nagging through it, and then all of a sudden Matt comes in the door and is like, hey, here's how to do some self exercises. And they're like, I really just need to come see you. I've been doing these things and I'm not getting better. Right. So like being available is also just as important, and, there's also the social media that you can use. Like I'm the old guy in the room, so it's not my forte, but we have it, so I think it's, again, the whole idea of like drip marketing and that stuff, it probably works because it keeps things on the forefront of people's minds, right? And so then that's also the little nudge that sometimes people need to realize that maybe this is out of my control. I need some external support, and then we take that external support, right? So
I was getting ready to wrap up with you guys here, but you sprung a topic on me that I just have to ask you about. I was spending my morning downloading some images and messages from the APTA website and putting them out on my company's social media, and at the same time thinking that for a small practice and a small community, man, is this really worth my time? I don't know. Do you guys think so? A practice with a social media page, do you think it does a lot for you?
I
Is the juice worth the squeeze?
well, and I'm gonna cycle back to like my default. Matt might feel the same way. Like we're not social media people. Like I said at all, and I'm not either. Like when I was a gym manager for a few years in the CrossFit gym, like I knew we needed to be doing social media, and I was awful at it. Like and knew like it was an important thing. And because what people asked for it in the gym, like people and what like to me I was like, why do people care if I'm posting on Instagram or posting our gym stuff on Facebook? Well, because they have a connection to our business, right? They want to share things. So that's something that we end up talking about a lot at our meetings is like, hey, what are we doing that we can share that people want to highlight to others, right? Like when someone, and I mean, I'm going to speak to from a coach for a second here, but like when our gym would go to a community event and like highlight something, or we showed something that we were doing in the gym that was pretty cool, like in CrossFit, we're doing rope climbs or tire flips, right? People associate with that. Like people had a pride in like, hey, I'm doing this thing that's cool and hard and difficult. Then from like the physical therapy perspective, people are like, hey, I got so much better here. Like Matt helped me. Like I'm patient right now. He's like, I could not lift an empty barbell and now I'm deadlifting 200 plus pounds. Like I want to show that like this place helped me. Like they connect and have that and that's what social media does. Is it like Matt said, that little bit of reminder of stuff. Well, people want to stay connected to this business because a part of them is like you've become a part of their life. Like they want to keep connected with you. That's why we have social media and Facebook. You want to know what your high school friend's doing, even though you haven't talked to them in 10 years. Like you like to keep up with what he's doing. Same with the business. Like, oh, what is Dynamic doing? And it keeps you on their mind, and then at the same time it keeps them like connected to you, and that their inherent like little benefit and joy that they had gained while they were working with you. So that's my take. I don't know if Matt has anything to add.
Yeah, and I think it comes down to the other side of like, you know, there's millions of experts online, right? So you just got to be one of the experts out there that that kind of fits in the mold, so that people do think you're relevant. I think is probably the bigger thing, right? So if you don't have a presence, is that harmful because now you're not an expert, right? Versus if you have some level of presence. I'll admit I'm not on there all that much, but I'm also someone who's been established, so I have a local following, right? For those who aren't established, like that's the first thing we do with our new hires, like let's get you established. And I get comments from my patients all the time about, oh yeah, I saw Jake do this, little mobility Monday. I thought that was a great idea. Like so, even those patients who have an established therapist are still watching those. And then a lot of times it does make it easier. I know we've touched briefly on this about like employees, like my schedule is full, so how do I get patients to now transition to other therapists if I'm their physical therapist, if I'm going to be gone? That's how you create that then brand or community, that it's not that they just trust Matt, they trust every therapist at Dynamic. So
I love it. I think those are two great takes by you guys on that. Is there anything else that's just burning in your brain that you wanna share before we wrap up here?
I think the biggest thing is and I always sometimes, like I said, let my own biases sometimes shine a little too much in terms of like, I really felt like my handcuffs were on me when I was working in the healthcare system. And so my biggest goal was to try to free ourselves from some of the burdens that not our profession has made, but just some things that just have grown throughout our societal growth, right? In terms of how we're expected to treat things, how we're expected to pay for the things. And the only way I could figure out to kind of get the cuffs off were, every patient comes to us at a different point of readiness to change, and the only way we could get there is when it was a one-to-one conversation, right? We take out the third parties and have that solid conversation, right? Here's what you need. Here's what I can do for you. And every patient comes at a different point in that trajectory. And so some patients may come in and they're not ready, and that's okay. But we can plant the seed for them when they are, right? And then we can help that seed grow over time, whether it's in person, whether it's through social media, whether it's through check-ins. I think that's the reality of when you go back to a one-to-one consumer to provider relationship, you can have those conversations, like in terms of helping people, really go through that motivational interviewing, creating that patient care alliance, start where they are, take them to where they want to be. And I think that's kind of the big thing that I love about the one-to-one provider option versus, whenever you add that third party, you gotta be careful what that third party's doing.
Awesome. Thank you
I guess
guys
one
so
more
much.
thing.
Oh, do it,
I
James.
can. Sorry,
Give me
James.
one
That's
more.
gonna turn it back to me. I wanted because we could talk all too long. Me and Matt could talk too long at the clinic all the time. I think the last thing I would add, and especially like as technology evolves, like with like the AI things here that keep coming out, right? Like I can't tell you now how much I just go on these AI apps and test what they know, like and to see what they can provide me information. Like I've typed in, my shoulder hurts. Can you provide me a physical therapy program? And it will give you a physical therapy program. It will tell you what you have. Now it does its caveat of you need to see a healthcare provider or a physical therapist, but people are going to start like having more and more access to information. So that's what us as clinicians need to be prepared for, is like the human connection and how we can provide a different level of service besides here's a handout of exercises. Like they shouldn't walk away from an appointment feeling like, hey, I just got these exercises and stretches to do, like that they made a connection with us. And having done a residency and working with Matt, like that is some of the thing that does the set. I mean, I feel like a step further than what I had previous to it, in that learning how to work as a patient-centered clinician and communicate effectively and meet people where they're at, just like Matt had just said. That's what kind of sparked me to think of that. Because that's what's going to set us apart in 5-10 years from now, when I can have a robot tell me what's wrong with my shoulder and how to take care of it. Like there's got to be something more than that. So sorry, that was the last thing I was gonna sprinkle in.
No, that's a great bring it home point, because I feel like I went into this expecting to have a conversation about um, cash self pay PT, and I feel like while we talked about that, we more had a conversation about connecting with your patients and having personal relationships. There's definitely a huge thread of that ran through this discussion. Um, and I think I got a lot out of it. I hope other people who listen will too. So thanks, Matt. Thanks, Jake. I appreciate you taking the time so much, and I appreciate everybody for listening to this. This has been Orthostatic, the podcast of the Academy of Orthopedic Physical Therapy.
Thanks a lot, James.